talking about heavy metal toxicity. We're going to be getting into it as an introduction here. And then I go into quite a lot more detail about heavy metal toxicity as it relates to anxiety and depression in my membership. And so if you haven't heard, I have a new membership where I teach on these topics so that you can become your own mental health expert. And so here I just wanted to introduce the topic just to get you started. And then I did a podcast with Wendy Meyer where I dig into this in a lot more detail, and you can access that for free. Just go to my website, drnicolecain.com, and in the search bar type in heavy metals, and you'll get access to that free podcast there. And so today I want to talk about this issue that we see with anxiety and depression that seemed to be impacted by our hormone levels, but every time we test our hormones, they come out normal. And so if you find that you've had your testosterone looked at, if you're a male, you have low testosterone, and then every time you try to treat it and your testosterone levels go up, that it causes anxiety and depression. Or as a female experiencing your menstrual cycle or postpartum or going into menopause, as your hormones are changing, you notice changes in your mood. Maybe you get more depressed or you get irritable or more anxious, but every time a doctor looks at your levels, they're supposedly normal. And so if this resonates with you, it could be that your hormones are in part regular and normal, but heavy metals are interfering with your body's metabolism and use of hormones. And so there are a few metals that we want to take into consideration, and then in my other video I'll talk more about those metals, where they come from, how to test for them and detox them. But just for purposes of today, I want to introduce you to these metals and just tell you a little bit about how the metals can interfere with our moods and our hormones. And so I have some notes here, so to make sure that I don't miss anything for you. And so the metals that we really want to pay attention to are arsenic, which is arsenicum. So we want to think about arsenic, cadmium, mercury, lead, uranium, and platinum. And so what these do is that they interfere with enzyme systems, hormone systems, and organ systems. Enzyme systems, hormone systems, and organ systems. And so we get exposed to these metals in groundwater, in food, in air, in pollution, in exhaust, and even some supplements and medications. And they can interfere in all sorts of different areas of your metabolism. And so you may be getting symptoms of anxiety and depression, and they may be treating you with supplements and vitamins and medications and functional testing. And if you're not getting results, maybe they haven't actually looked at one of the root causes of toxicity. And so let's just take a little peek at a way that these metals can actually interfere with dopamine. And so you know of dopamine as a neurotransmitter that's responsible for feel-good sensations, feel-good mood, feel motivation, purpose, happiness. We know that when dopamine is too low, that we can feel a lack of motivation, we can feel depressed, and we know that when dopamine levels go way too high, it can cause symptoms of paranoia, anxiety, risk-taking behaviors. And so in order to make dopamine, we need enzymes. We need things like zinc, and we need B vitamins, we need selenium. And so what can happen is if you have metals in your system, they can actually act like a Trojan horse and insert themselves into those pathways. And then that pathway is now being clogged up by that Trojan horse, is being clogged up by that metal, so that your enzyme system isn't able to work to break down your amino acids into dopamine. So you have enzymes using vitamins and minerals. These enzymes help you to make your neurotransmitters like dopamine. If you get a heavy metal in the place of, for example, zinc, then that enzyme pathway doesn't work and you can't make dopamine correctly. So that's an example of an enzyme system disrupted by a heavy metal. And so getting to the root cause of, are metals part of your conversation? Are heavy metals part of why you may feel anxious or depressed or have issues sleeping? If you've been taking medications and yet you're still not getting better, or if it's difficult to get off of your medications, it could be due to heavy metal toxicity. So check out the blog. I teach quite a lot more about this. And if this is something that you really want to dive deeply into, then check out my membership. You can learn about that by going to my website, drnicolecain.com. And then there's a big button there, and you can click on it and learn more about it. Right now it's $1, which is just my way of kind of welcoming you, because you're a part of my community, just welcoming you into getting more of an intimate relationship where we can really teach you how to be your own mental health expert. So yeah, leave questions here and I'm happy to answer them. I'll reply in the comments. You can send me a direct message, but my guarantee is that if you have a question, then other people probably do too. So for sure, leave us a comment. All right, thanks for watching. Take care.